Without Medicaid expansion, the reimbursements are falling, and hospitals like the one in my hometown are on the brink of possibly even closing.
Tonight, Mayor Adam O'Neill of Belhaven, North Carolina, continues to try to rewrite the future of health care in his town. In June, the Republican mayor went to the state capitol in Raleigh to publicly call on North Carolina's Republican governor and Republican-controlled legislature to accept the Medicaid expansion in the Affordable Care Act so that the hospital in his town would be able to stay open. That hospital closed July 1st. So Mayor O'Neill took his crusade to save our hospital on the road, walking 273 miles in 15 days to Washington, D.C. to meet with federal officials. Now, the Department of Health and Human Services says it will investigate whether the closing of the hospital violated Title VI of the Civil Rights Act because it will have a disproportionate adverse effect on the ability of African Americans and Hispanics to access necessary medical care. Joining me now is Belhaven Mayor Adam O'Neill. Mayor O'Neill, thank you very much for joining us tonight. Your crusade continues. What does this new investigation under the Civil Rights Act mean for the prospects of the hospital reopening, and what other ways, what other factors have emerged that might be able to get the hospital open?
Well, the first thing is we need officials to come to town and see what took place here. It's my opinion that the way our community was misrepresented, and the way our hospital was closed down should be a crime, shouldn't be allowed to happen. We had a critical access hospital that actually could run at a profit closed down for a greedy nonprofit. I call them the billion-dollar bully now, Vidant Health. And we've had that take place, the investigation's going on now, but we've also had a lot of people working together who have put enough pressure on the local LLC that hopefully in the next 2 to 4 weeks we'll get our hospital back, the actual facility, and then we're going to be able to take some of the inroads we've made with raising money and get this hospital going as soon as possible.
Let's listen to how this issue came up during the Senate, the debate for the Senate seat in North Carolina.
ECU and Vidant are having unbelievable problems because of no Medicaid expansion. We've already had one hospital close in Belhaven. Speaker Tillis is proud of the fact that he hasn't expanded Medicaid.
That's, of course, incumbent Democratic Senator Kay Hagan. She's running against the Speaker, who was very much a part of making sure that North Carolina does not have the Medicaid expansion. Mayor, do you believe that this hospital would be open today if North Carolina had accepted the Medicaid expansion?
I think it's quite possible. North Carolina not accepting Medicaid expansion is costing our healthcare system $10.9 million a day. 10% of one day would have broke our hospital even in 2013. So it has a big effect. We're talking about over $3 billion that's not in North Carolina's healthcare system because we didn't accept Medicaid expansion. You have the reimbursements falling for people who can't pay, the indigent care, and you have a situation where Medicaid expansion was supposed to fill that gap. If you don't have Medicaid expansion to fill that gap, you have a problem. And small hospitals that struggle every year to survive, what happens is they end up running into red, and it causes problems.
Mayor O'Neill, I know your confidence is building on reopening this hospital. Please come and join us on the night when you get it reopened.
I'm 100% we're going to get it reopened. It's just a matter of time. Everybody's working hard here. We have rich, poor, black, white, Latinos, everybody's working together, and we're going to be successful. It's just a matter of time.
Mayor Adam O'Neill of Belhaven, North Carolina, thank you very much for joining us tonight.